Namaste. Welcome back to SLG Hello Doctor that hosts for you easy to understand conversations with healthcare experts on a wide range of topics for your well-being and awareness. No one likes the C word. All of us are wary about it. But are we aware? Recent statistics spell a startling future and there is no escaping the blueprint. Breast cancer is the most common form of cancer in India. In urban centers, breast cancer accounts for 25 to 32% of all female cancers. It's also seen to be more common in the younger group nowadays. Almost 50% of all cases today are in the age group of 25 to 50. Breast cancer, however, is a treatable disease and the chances of survival are much higher if it's detected in time. However, in India, the detection takes place late. More than 70% of the cases present in the advanced stage, which means the chances of survival are quite flimsy. The only way to change these numbers is by increasing awareness about self-examination, screening, and adopting new ways of treatment. Today, we will be talking to Dr. NVS Ramakrishna, Senior Medical Oncologist and Head of the Department of Medical Oncology at SLG Hospitals, Hyderabad, about breast cancer, its treatment, and new advancements in the field. Dr. Ramakrishna, we are so glad to have you here on SLG Hello Doctor. Thank you for making time for us today.
I'm glad to be here.
So, shall we begin at the beginning, as they say? What are the symptoms women should look out for in the context of breast cancer?
So, painless lumps and discharge from the nipple, these two important symptoms should note by all females.
Doctor, how is breast cancer diagnosed?
So, normally self-examination and the mammogram and ultrasound of the breast, these three important modalities of detecting the breast cancer. Normally, these patients have painless lumps. So, every painless lumps should undergo the mammogram and ultrasound of the breast.
Doctor, we all know that the occurrence of breast cancer can be attributed to many factors. Some factors can be changed and some factors cannot be changed, such as genetic factors. What is the importance of genetics in breast cancer?
The leading genetic risk factor is BRCA mutations, which occurs in the normally takes decoding in the DNA mechanism that leads to BRCA mutations. It occurs in 0.3% of general population.
So, what are the ways in which to screen breast cancer? Are they painless? Are they invasive, non-invasive? Can you talk to us about that?
So, breast self-examination is the one important modality for any female to examine herself. The second thing is a mammogram. Mammogram is important tool to detect the breast masses, and the third important modality is ultrasonography of the breast. Simple ultrasonography of the breast can detect the masses in the breast.
Doctor, as the adage goes, prevention is better than cure. Ideally, at what age should women go in for breast cancer screening?
Normally, we start screening at 45 years of the age of the people, but who carries a BRCA mutations, screening starts at 30 years of the age. Every 2 years you have to screen the people.
Doctor, once a girl or a woman tests positive for breast cancer, what are the treatment modalities available today? Have they gotten technologically advanced in recent times?
Once diagnosed with breast cancer, we have three modalities of treatment. One is surgical, surgery, radiation, and chemotherapy. Chemotherapy, we have a recent modalities like immunotherapy and targeted therapies. So, role of immunotherapy in breast cancer. Suppose we get a triple negative breast cancers in women, means that the ER negative, estrogen receptor negative, progesterone receptor negative, HER2 negative. In this set of patients, we will use immunotherapy, like drugs like pembrolizumab.
Doctor, chemotherapy as a treatment modality is really scary for both the patient and the families because everybody knows about the adverse side effects. So, can you tell us if there have been any advancements lately that have kindly set these fears aside?
Recently, newer techniques in chemotherapy have come to the market. One is the immunotherapy, which has very less side effects while using these drugs.
So, doctor, you just mentioned immunotherapy. Can you just elaborate on how it works?
Immunotherapy is nothing but stimulate the own immune system to fight against the cancer cells. Especially we have a T cells in the body. So, by giving these injections, immunotherapy checkpoint inhibitors, by giving we stimulate the T cells to kill about our own cancer cells.
It's time for a short break on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ ఎస్ఎల్జీ హాస్పిటల్స్. ప్రముఖ సామాజికవేత్త, సంఘ సంస్కర్త శ్రీ దండు శివరామరాజు, చైర్మన్ అండ్ మేనేజింగ్ డైరెక్టర్, మరియు శ్రీ డివిఎస్ సోమరాజు, ఎగ్జిక్యూటివ్ డైరెక్టర్ గారిచే స్థాపించబడిన ఎస్ఎల్జీ హాస్పిటల్స్
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ జేసీఐ అండ్ ఎన్ఏబిహెచ్ ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స,
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స,
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ఐసీయూ బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు,
3 టెస్ట్ల ఎంఆర్ఐ, సిటీ స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక ఎస్ఎల్జీ హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133399500,
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678. తెలంగాణ మరియు ఆంధ్ర ఆరోగ్యశ్రీ సౌకర్యం కలదు.
Welcome back to SLG Hello Doctor. Today we are talking to Dr. NVS Ramakrishna, Senior Medical Oncologist and Head of the Department Medical Oncology at SLG Hospitals, Hyderabad, and we are conversing about breast cancer. In the treatment modalities, you also mentioned radiation therapy. Can you tell us more about that, please?
Radiation is indicated when the tumor size is more than 5 centimeters, node positive disease, and locally advanced breast cancers.
Doctor, what are the ways in which you would treat a woman who presents with a BRCA gene mutation?
We have a new drugs called PARP inhibitors. We'll give these PARP inhibitors for a long-term maintenance therapy in these patients.
Doctor, since BRCA mutation is a genetic issue, is there a chance of men carrying BRCA mutations and in that case leading to breast cancer in men too?
Suppose men carrying a BRCA mutations, almost 10% of the people can develop breast cancer in their lifetime.
Doctor, so is the treatment the same for them as it is for women?
So, men with breast cancer, the treatment is same as we follow in women.
Doctor, if a woman develops breast cancer because of BRCA mutation that she harbors, is there any chance of her developing any other type of cancer?
Patients having BRCA mutations developing a contralateral breast cancer will be 10% of the people. And at the same time, BRCA mutations carriers developing a gynecological malignancies, especially ovary, will be 40% in their life.
So grateful to you, Dr. Ramakrishna, for this interesting interaction about breast cancer. Do you want to leave our viewers with some parting advice that they can follow easily?
So dietary modifications and regular exercise, these two important factors to prevent the developing of breast cancer in women. Those are taking oral pills, oral contraceptive pills, hormonal therapy, that's called oral hormonal therapy for different reasons, should be aware, and these people likely to get breast cancer in the lifetime is 20% of the patients. Should be aware, and screening should be started at the 35 years of the age. Any female patients are taking chest wall radiation for different like lung cancer, Hodgkin's lymphoma, developing a breast cancer will be 30% of the in their lifetime. So screening should be started immediately after 5 years of completion of radiation. The old chemotherapy will cause a lot of side effects like hair loss, and the white cells will go down and mucositis. But a newer immunotherapies, targeted therapies doesn't got these side effects. These are very safe drugs nowadays present in the market.
Viewers, hope is a powerful force. It's the nourishment for will and courage. If you or your loved one is going through the travails of breast cancer, hang in there. Follow your doctor's advice. Be regular with the medical and lifestyle regimen prescribed. And most importantly, stay positive and hopeful. We will be back with you soon with yet another topic that will help you lead a healthier life. Until then, take care and keep smiling. Viewers, hope you've hit the bell icon and are following all that's happening on SLG Hello Doctor. If not, do it right away.